APIE assessment, planning, implementation, and evaluation. The APIE stations are all 15 minutes long. During that time, you will meet a patient first in the assessment that has a set of nursing problems, a social situation, lifestyle habits, and concerns. Each patient requires a review, a plan of care and treatment, and finally, a written handover. Each station uses an aspect of the nursing process to care for patients throughout their stay in the ward or when you meet them in the community. It is during this time you can demonstrate your effective communication, analytical and documentation skills, and also the nursing knowledge that you possess. Skills on focus. The assessors are looking for nurses to provide care that falls within the NMC standard, spot hazards, as well as plan for optimal outcomes for the patient. You should be able to communicate this clearly to the patient and their family. You need to practice these skills repeatedly until you are competent and feel confident. Your first step is reading the material in this course and taking the videos and audios. Please attempt the quizzes to test your knowledge. Case scenarios during the test. Number 1. Head injury. Number 2. Respiratory. Head injury. The head injury patient who has always sustained a small subdural hematoma requires a certain type of standard assessment common to all head-injured patients in the UK. The Glasgow Coma Scale (GCS) is the most common scoring system in the world used to help gauge the severity of a brain injury. As a nurse, you are meant to be competent in using this scoring system, and so the scenario is used in the OSCE. The head-injured patient in the OSCE has a set of problems, often seen in those suffering from a mild head injury. The patient is never very unwell or severely deteriorating neurologically, and so you need only to deal with mild symptoms like disorientation or slight drowsiness. Use evidence-based practice to ensure you assess the patient effectively and are able to score and escalate the results as per GCS protocol. Respiratory. The respiratory patient will present with a chest infection or having had an episode of exacerbation of asthma. They are not a person in severe respiratory distress, but rather have mild, moderate symptoms. These are normally manageable with mild painkillers, antibiotics, or bronchodilators. Other general non-pharmaceutical interventions such as deep breathing exercises, relaxation techniques, and repositioning are sufficient for this patient. If the patient has supplemental oxygen on when you meet them, this is something you must take note of and include in their assessment. The patient is not becoming very unstable, and you must concentrate on completing the chart primarily and some health education. You must complete the News 2 National Early Warning Scoring 2 chart accurately and completely to pass.